Lessons podcast. I'm your host, Anthony J. Algeman. Data is everywhere in our businesses, and it takes leadership to make the most of it. We bring you the people, stories, and lessons to help you become a data leader. Today I'm joined by Kasu Sista, a data management thought leader and mentor of mine for many years. He's the founder of the Wisdom Chain, a local Chicago area data management consulting firm. Kasu has tremendous experience in management consulting, startups, and has built data systems and governance capabilities for organizations in, I think, every industry that exists. Kasu, welcome to the program. Please take a few minutes to give the audience some of the highlights of your career.
Thank you, Anthony. Thanks for having me on this program. And so the Wisdom Chain, my company, pretty much follows my career. So if you talk about the chain of data, data to information to knowledge and to wisdom, really my career started out that way. Dealing with the data at the lowest level. I worked for a options exchange where I used to handle the ticker data and had to make that into a consolidated ticker and give it to the traders. And that was my first realization that users typically don't care about how cool your program is or how cool the technology is. Right?
Ain't it the truth? Ain't it the truth?
So I had this really high opinion of myself as a developer.
Yeah.
And I was using all kinds of techniques. I was a computer science graduate. Mm-hmm. And then I go to the traders and say, look, all the stuff I did is like, well, that price doesn't look right. Right. So it's really boiled down to, and that was a huge lesson for me. And that same lesson had to repeat over many of my career steps before it actually, it got ingrained in me.
Sure.
That nobody cares if it's Java, C++, what operating system, just keep it to yourself because other people don't really care about it. Right. And so from there, I worked for a funds transfer company. And that's another place where data and data quality and the governance, we didn't call it those things in those days, but became really important because the accounts had to be right. Mm-hmm. And the routing numbers had to be right. Right. So you're going to the right bank, you're going to the right account, and the money gets deposited in the right person's account. Mm-hmm. So without knowing, I got into the path of the data as I went along.
Sure.
And then basically I started a client server data company. Mm-hmm. And so we did a lot of data modeling. And as part of that, I met some of the luminaries now thought of as, the stalwarts of the industry like Cod and Date and Peter Chan, and some of these guys were my colleagues. Right? I mean, I didn't work with them, but, and as consultants, we used to run into each other and we'd have lunches and dinners. And Larry Ellison, for example, I used to run into him at shows because he would be there with his Oracle database and a computer.
Oh, yeah.
And so really, and then from there, I progressed into management consulting. I worked for Navigant for a little while. And then started a company that did visual search. Again, it's storing pictures as data. Mm-hmm. How do you model that, right? So that's another. And then eventually, when you met me, we were both working for a management consulting firm. At that point, I was really beginning to, we started the BI practice at the consulting firm, right? Yeah. And then we did metadata management, data governance. And then since then, I've been focusing on those aspects of data management. And at ConsulLink, it's really more of bringing together all the things that I learned as a data management professional and building a warehouse and saying, what's the most important data that we need? Mm-hmm. And what data that we need to take care of. And we'll talk about this later as, what the lessons learned were from ConsulLink in more detail.
Yeah.
And to now where I am trying to help corporate clients with incubating and implementing data governance programs. So going into more than just doing strategy, right? How do you actually get governance on the ground.
Right. Well, I want to mention, because this is one of the things that, like, our friendship and relationship was built, like, for folks out there that haven't done the glamorous life of being a consultant. Let me tell you a little bit about a project that Kasu and I were on, and I won't talk about the client or the project specifics, but the thing that I remember is that we had to travel from Chicago to Baton Rouge, Louisiana, and there were basically two ways you can get there. You can either, like, fly through Dallas and take a connecting flight to Baton Rouge and then be there, but you have to take two flights from Chicago. And Chicago, we're all spoiled because you can usually fly direct to wherever you want to go. Or the other way, which is the way we ended up taking, which was we would fly to New Orleans and then rent a car and then drive about an hour to get to Baton Rouge. So every week we would be there, very early Monday morning. We would be at the airport, hanging out, having coffee, talking before the flight. We'd have the flight. We'd get into the airport in New Orleans. We'd walk. We'd go get the car, and we'd take this drive through pretty boring terrain between New Orleans and Baton Rouge. Yes. And we'd talk about this stuff. We would talk about data. We'd talk about data management. We would talk about, what the client was facing, but also what are the bigger picture things and how does it all connect? And what's been fascinating is in seeing how your career trajectory has gone. Mine kind of models similar things where you just kind of start in technology circles and you're building data systems and you're doing data modeling. But then the longer you go, you realize just how important all of this is to the businesses that you're serving. And so the work that you've done in some of those startup businesses, and you mentioned ConsulLink, to me, the next extension is not only is it important to the business, but it's important to their customers and the people behind it. And some of the work that you were doing at ConsulLink, especially, really touched the lives of the people directly because of the data. Can you talk a little bit about that?
Absolutely. So, I was part of a private equity home office, right? Comer, Gary Comer was the founder of Landsend and is well known in the Chicago area. Mm-hmm. And they always wanted to do something for the underserved in the Chicago area, especially the south and southwest and west side of Chicago.
Right.
And so they established this care management company, which has a very innovative model. And what they would do is they would send non-clinical workers into the neighborhoods to find out what the needs are in the neighborhood and who are some of the more high risk patients, right? And give them personalized attention, right? Arrange transportation for them, for example, arrange for somebody to watch their kids. It's not just care management in the sense you get a phone call from your insurance company and he says, how are you doing? Go listen to our podcast. It'll tell you how to manage your diabetes, right? Yeah. And that's really the extent of care management, at least back in 2013 when we started counseling. And so that company needed some way of determining who the high-risk patients are. Mm-hmm. And informing the clinics, because we were actually supplying reports to about 22 hospitals and 180 clinics in the Chicago area, right? So the data that we used were claims data, both pharmacy and clinical claims, and admit, discharge, and transfer data, which is real-time alerts, and a whole bunch of historical data we had on these patients because they've been Medicaid patients, almost 6 years worth of historical data.
Right.
And so we had to combine all this data, warehouse it, and be able to generate reports on a daily basis, most of the time before 8 or 9 o'clock in the morning, before the clinical workers came to work. Mm-hmm. The workers came to work. And we had to do that on a daily basis.
I just wanted to interject for a second, is that it's amazing to me that you guys were providing, this is 2013, this is 7+ years ago, right? You're providing this service, holistic medicine, and like the things related to care for Medicaid population, for folks that are disadvantaged, because they're literally not going to get to the healthcare if they don't have those services. But in times that we're recording this with the coronavirus outbreak and COVID-19, we're seeing a fundamental breakdown in this kind of transaction-based medicine that the rest of our healthcare system seems to be revolving around. Like that's the foundation of it. And so we're now needing that kind of care for everybody. And it's not there. It's not there at all.
It's not there because the people that the way our health system is set up is not geared towards that. Right? It's right. Not geared towards reaching to the patient. It's geared towards the patient coming to the provider.
Yeah.
Not the other way, right? And you see this shift because care management has become much more important to all the providers and payers now. Mm-hmm. And people are shifting the models, and mostly because of the data that's available and the data analytics that are available, right, around this problem. Mm. And so, yeah, I mean, if you look at, we're going to have a very interesting conversation once this is over about national health care.
I think
and
you're right.
Where healthcare should be coordinated from, right?
That's right.
And so it's going to be a very interesting conversation around healthcare, not just around healthcare, but around essentials. Right? Mm-hmm. How do you manage essentials when something like this happens?
Right. So you were talking about something else with Consulink, and I want to kind of bring it all the way forward to where you worked at Consulink for several years, helping them do something that was to me I spent a lot of time like you. I spent some time in the financial industry, and I always felt it a little bit empty. Like I wanted to do something beyond just making rich people richer. And I felt like, working in something like Consulink where you're impacting real people very directly through the work that you're doing. There's something to really be, there's something beyond a paycheck that you get by doing something like that. And I know that's something that's important to you as well. Since then, what have you been up to, and what is the Wisdom Chain all about? You touched on it before, but I want to, make sure that people understand this is what you're doing now. Yeah.
So basically what I see is data is important, right? Mm-hmm. So we talked about my career and how I got into data. And so data can be used for, like you said, for empty purposes. Right? Mm-hmm. Or data can be used what I call mission-oriented purposes. Yeah. Something that's going to help somebody. So I'm really been working mostly since I have, we sunsetted Consulink. I've been working with companies that are mission-oriented, right? Mm-hmm. I work with a medical devices company, and they make devices for people to be able to be active. Mm. And they had issues with their master data. And they need a governance around that and the data quality program. So I was part of a team that established that. Mm. And then for the past last year, about 6 months, I spent incubating a data governance program for a large provider where they're having issues with all over the place, right? Because healthcare is, we say healthcare is behind technologically. There are reasons for that. Mm-hmm. So it's not because healthcare organizations don't want to be forward thinking. For the most part, how healthcare system works in this country, the regulations, the state level mandates, the federal level mandates, prevents them from being able to do what they need to do. For example, I'll give you an example. HIPAA prevents you to talking about your patient to anybody but the patient, their provider, and probably the insurance company. Mm-hmm. Right? And that makes it really hard to share that data without a lot of paperwork, a lot of consents that has to happen. Right?
Yeah. Well, and that manifests in real world problems that people have. Like we talked about kind of that transaction nature of the business. Well, how many people do you know? I mean, everybody has a story around how they had a claim that got denied and everybody pointed fingers at everybody else because each player has a small little chunk of that entire value stream. Nobody wants to take the responsibility, or nobody knows how to take the responsibility, or are literally prohibited from taking the responsibility to solve these problems because things have been chunked up so much, and the you could add on top of it incentive structures and the dollars and all of that. It becomes a real pain. But I think that you make a good point though. Like, we've put a lot of restrictions on how data can be used, and for good reason. Like, we're not saying that they should be selling people's healthcare information to other companies. Nobody wants that. But what we do think is how can we help foster innovation through data in the healthcare space amongst this wide variety of players that exist out there?
Yeah, and then we have a very mobile population prior to corona.
Yeah.
Virus, right? I mean, I used to be on the plane every week. And so if something happened to me while I'm traveling, obviously I go into an emergency room or emergency care or go see a doctor. To get that information to my provider, to get that information to my insurance company is not non-trivial.
That's right.
For example, if you remember that payer that we worked for in Baton Rouge, they used to have it was a Blue Cross Blue Shield. Mm-hmm. So Blue Cross Blue Shield has this back channel they call Blue Cross Blue Shield Association, which is really networks all the Blue Cross Blue Shield payers, which sends these transactions. So if I see a Blue provider in California, that claim on that information, it has to come to the Blue, my home Blue, mm-hmm. which may be Chicago or Baton Rouge.
Sure.
And that transfer has to happen because everybody has a different system.
Right.
And so, as much, I'm going to digress a little bit, as much of a bad name that VA gets, they're at least integrated across the nation.
Yeah.
Right? They have one system. So if somebody in the system in West Virginia, and that person happened to move to Oregon, mm-hmm. Their information is available. So there is something to be said about integrated systems, integrated healthcare data. Yeah. Not in terms of organizations. Now we talk about integrated delivery networks, which talks about integrating, the payments and the clinical stuff and the deliveries, both ambulatory and inpatient, integrating all those. But we don't talk about integrating horizontally and saying, from a patient point of view, is my data integrated? No. I see a few specialists and I have to go across 3 different Epic systems. Mm-hmm. Epic is now getting to the point where, it'll show me in a dashboard. It'll pull data from all the different systems, show me in a dashboard, my personal data. But if I happen to go outside of Epic, now I'm out of luck. I need two apps, right, to look at. So it's not always the health system's fault. I mean, we tend to fault the people that we see.
Yeah.
But our government has a lot to do with why healthcare systems are the way they are.
Yeah, well, if healthcare systems and it trickles down to who's building data systems for those individual entities within the healthcare systems, they're solving their immediate job at hand. How can I support the operations of my unit in this whole chain? Versus there's not a real voice for saying who can provide data systems to help the patient, to help the people that are trying to get this. Nobody's looking at it from that point of view. Patients aren't building their own data systems to put this stuff together, and so there's nobody from that perspective. That should be what the government does or mandates, that, hey, while you're watching out for number one business in the healthcare industry, also watch out for the real number one, which are the people that should be served in terms of getting the healthcare that you are part of providing. And I think that's a really good point. I want to shift gears, because I know that, you and I both, we've done a lot of work in data governance and data management consulting specifically. And for those that aren't super familiar with that, it's really about kind of all of this data systems tapestry and how it connects not only to other technology and the flow of data itself and the databases and all that, but really how people use it. What are the things that people should be doing with the data to have better organizations as a result of whatever those activities are. And so data governance and data management really help influence a lot of that, because otherwise people would just be kind of off doing their own thing, trying to figure it out on their own. But one thing that, and you and I have had many conversations over the years about this, is that it's really hard to be successful in data governance consulting. It's really difficult to have businesses like ours that do this kind of work. Why do you think that is? What is it about this kind of function inside organizations that makes consulting in it so difficult to do well?
And, it's a very good question. And this is something that's been on my mind for a while, because I have started many data governance programs. Mm-hmm. I have done quite a bit of data governance strategy and data management strategy. And it always ends up becoming a small effort as part of a big effort. It never seems to grow big enough to encompass. And I think there's a couple of reasons for that. One of the main reasons I think is really awareness. Mm-hmm. What data governance can do for people. I refer to it as diet and exercise. Right? Mm-hmm. People kind of vaguely know that if you eat healthy and you exercise daily, then you're going to have a productive, happy life. Right? And that's basically what we're selling. We're selling diet and exercise for data. And how many people are really interested in diet and exercise, right?
Right.
And so I think we have a marketing problem more than anything else. We're saying, how do I create awareness in the company? Because it always seems to be pockets of people that are really interested. And as a result of, for example, audit or compliance would be really interested because auditor came in and said, you need governance. Mm-hmm. I was at a client, it's kind of funny actually. So we were there to do a data governance strategy, because their auditor said, you don't have a data governance strategy. And they said, we need one.
Oh, yeah, it happens all the time, right?
And so turns out the auditor was carrying out a book by John Landry on data governance. Mm-hmm. And so he was reading this and he says, you guys are in payment business. You should be doing data governance. That's right. So the regulator, and I think you have a funny anecdote about regulators too. You can get to. But he was reading, our buddy John Landry's book, and so he saw what some of the things that John Landry laid out in terms of governance, and said, so the bank has a directive to put data governance in place because the regulator read a book, right?
Yeah.
And so things like that happen, or there is a breach, and then all of a sudden security becomes important. Right. Governance becomes important. But you never think about governance in a holistic fashion, because that goes back to the root of how data gets created, right? You and I talked about this many times. Companies are not born fully formed $10 billion companies.
Right.
So when you started your company, were you thinking about data governance?
Well, I wasn't thinking about data governance per se, but I was definitely thinking about, how can I, do the right things with data as my organization started to grow. Yeah.
Yeah. So with counseling, for example, when I started out, I was the first employee. I had to go build this organization, build a warehouse. The last thing on my mind was, how am I going to govern data, right? I'm trying to get the organization, build a team. And by the time we got to a decent size, 15, 20 people, I already has too much data and too many processes in place.
That's right.
And you had to go back and retrofit. And we did to a certain extent.
Yeah.
And so that's why things get messed up, because people are not paying attention, and they're not going to be paying attention.
Yeah.
So we have to go back and create awareness and say, show them cause and effect. Mm-hmm. If this happens, good and bad, right? Mm-hmm. Here are the good things that happen if you have good quality data. And here are the bad things that could happen if bad quality data. And that has nothing to do with steering committees, work groups, all that stuff. It has to be more come from the communication side of the company, the organizational change management side of the company. Mm-hmm. And that's my current thinking, is really the more straightforward, action-oriented aspects of data governance are well known, right? We've been selling these data governance frameworks for 15, 20 years now. Right. And I have heard very few success stories. I don't know how many you have known. Personally, most of them are very small, right? Mm-hmm. In terms of success stories. So how do we get back to people thinking about governance as something that helps them as opposed to something that hinders them?
Right? Yeah. Well, I think that, you make some good points, and I think it goes beyond just, how people are thinking about data governance. And I think a lot of the data governance organizations out there, even the ones that haven't been very successful, they're doing a lot of the right things. But I think that we've positioned data governance kind of historically as this kind of floating, nebulous collection of other stuff. Sometimes it starts like what you mentioned with a regulator carrying around John Ladley's book on data governance and saying, oh, we need to check a bunch of boxes now. Like that, that is how data governance gets started. But if that's the beginning and end of data governance, you're really going to accomplish very little other than checking boxes, right? And so it's about saying what matters. What matters? We have all this data. I'm like, people, organizations, you'll sometimes hear, they'll say, oh, well, we want to do data monetization. And I'm like, that's a great idea. That's fine. But recognize what data monetization is. Primarily, it's about helping your business monetize the value of data. It's not about saying, let's go find a bunch of businesses just wish they had more data. Those businesses don't exist. Every business has too much data. Even my tiny little consulting firm has too much data now. Like, that's not the problem. The problem is what we're doing with it. And where data governance has really fallen down, in my opinion, is that we fail to connect all of those activities to things that actually matter to the business and how we're serving our customers, how we're driving revenue, how we're doing the strategic things in our business. Because our data governance people have been focused on data. They've been focused on trying to do that early part of it and far less on the how does this actually matter. And it comes down to two things. It comes down to, one, making sure that what they do actually matters, and two, making sure people know that they did things that actually matter. Because I think that's where even the people that have done it all right with data governance and put in the things they needed to and check the boxes for the right reasons and all that still can fail, because they fail to bring that message and that awareness to the rest of the organization on just how important this is. And it's so frustrating for folks like you and I that have been in this profession for a long time that have said, just because so many people have done it wrong doesn't mean that this isn't important. Like, this is important, and failing at it is a huge detriment to your business. Now, one that may mean the difference between success and survival of your business and going out of business. And that's the stakes that this is. So even though it's hard, you know what? It doesn't change the fact that it's necessary. Do you agree with that?
Totally. So I'll give you an example with a counseling, right? So we had this report. It's called the ER alerts, right? Emergency room alerts. If somebody comes in, let's say I'm a clinic, I'm in Lawndale, mm-hmm. I have 50,000 Medicaid patients that I take care of. And chances are several of them are in the emergency room on a daily basis. It'd be good to know that, right? It'd be good to know my patient is in the emergency room and for these reasons. And here are the specific health conditions that he has.
Mm.
So we produce that report, and probably has 15, 16 fields on it. And most of the data comes from directly from the source files that we get, and we have a bunch of calculated fields, right? What was important for us to make sure that we are doing the calculations right is to establish the lineage for those 15 fields. So it's not a massive amount of governance we had to do. Mm. It's pick the important reports. If you can prioritize what's important for you from a finance perspective, from operations perspective, mm-hmm. and then if you can establish lineage for the elements in that report, both in terms of master data and the transactional data, that's a good place to start, as opposed to saying, I am going to govern provider data, mm-hmm. Which may be 150 fields. Do you really need to govern all of provider data? I don't think so.
That's right.
Right? So figure out, prioritize what you need to govern. And governance starts, for me, it was establishing lineage from where it's being used to where it originates. Right?
Makes sense. And that's a business facing function, because how many reports out there where an executive gets them, it's like, where's this data coming from? That's a question everybody hears. And we need a good way of articulating that, because sometimes it's complicated. And it's not, like, I think you make a great point. We can't solve for everything. We have too much data. We don't even know what to do with a lot of it. We can't make it all perfect. Like, that's not a viable option for us. So we have to pick our spots and decide on things that can really help drive something that matters. And I think when we're responsive to that, and we're out there working with the people using the data, the ones that are trying to drive better activities and decisions through their use of the data, and have valid questions about, can I rely on this information to do the things that I want to do? That's up to us in the data governance, data management world to provide them that clarity, to provide them, yes, you can do what you want to do with this data, or no, don't do that. That's going to cause problems. And we need to be, fair about it. We can't just be saying, well, here's the data. It should be good. Do whatever you want. Let us know if you have any problems. We need to be active in doing that, shepherding that, teaching folks how to do that more. I think that's why we see so much with data literacy these days, because organizations are like, yeah, it's great. We know data is important, but how do we get everybody in the organization working with this data in a consistent, meaningful, predictable, reliable way? And that's really what we've been trying to do for a long time under the umbrella of data governance, or under the umbrella of data quality. It's the same challenge using different words. Is that what you're seeing too? Or do your clients talk a lot about data literacy these days, or are they still talking a lot about data governance and data quality specifically? What do you think that kind of language is evolving, or is it still mostly how it's been?
It's mostly, I think, within IT and data management people. Mm-hmm. And it hasn't caught on. So here is, as an IT professional, having been an IT professional most of all my career, mm-hmm. I think we have sort of a parent-child relationship with our business people.
Yeah.
Right. We're always looking for approval. We're saying, hey, I did this. Is this okay? Right. And I think that has to change. I think one of the biggest lessons I learned over my career, wish I learned this way early in my career, is know your business. Doesn't matter you're an IT person. You have to understand how your company makes money.
Yeah.
Right. And your business people they're helping the company make money. Right. And if IT is not seen as making the company money or mm-hmm. helping them make money, then we're always going to be the stepchild. We're always going to be the cost center. Mm-hmm. So the minute I start talking in terms of business, like if I'm speaking to a pricing analyst, right, and I understand how his pricing tiers work, mm-hmm. why it's important to tier the prices in tiers. And then I say, hey, this is what we can do for you to make your life easier to maintain those tiers. That's a hell of a lot better conversation than saying, can you tell me how pricing works? I'm going to model it for you, right?
Yeah, that's so true. I mean, I feel like I have this conversation daily because you can't just hand over a piece of paper and say, tell me about the data systems you need, or tell me about we need to have that communication be bi-directional. I think about this all the time, and I talk about it in the book and things like that. It's like we have broken down these communication mechanisms between the business and technology folks or data folks to this one directional dump of, here are my requirements, go build it for me now. And that's just going to lead to suboptimal outcomes. Like, that's just not enough anymore. We need to be collaborative in a real way. And us as the data folks saying, how can we help you do what you need to do better? Because the thing that matters so much is that as data folks, whether we're doing data governance or we're building data warehouses or we're doing reporting or you name it, we require somebody else to take that and make it valuable in the organization. We need them to do something with it. And if we just build a bunch of cool stuff that nobody ever uses, we will not have added any value. And they will be right when they're like, hey, you're a cost center. You're not doing anything for us. Well, maybe we're not.
And we are, and think about it. We're uniquely positioned to understand how the company works.
Yeah.
Right? Because what is data? Data is the execution of business processes, right? And we are seeing the trail of how business runs.
Yeah, it's the artifacts. It's the evidence.
It is evidence.
I say it's the closest thing to truth that we have in our organization.
And we are uniquely positioned to have access to that.
Yeah.
Not, we see HR data, we see operations data, we see finance data, we see all the data, right? And then all you have to do is read your company's 10K filings, read your annual report. Right? I was just going through a annual report of a potential client, and they have 10K filing. They have identified 33 risks. In that, and just reading through the risks, I know what they're looking for.
Yeah.
I know how do you mitigate risk? How do you optimize for performance? All those, you don't even have to read, the 10K filing is like 400 pages. But there is gold in there.
Yeah. Oh, yeah.
As an IT person, you should read that. I don't care what level of IT you are at. Understand what your company is doing. Understand their business. And you'll be that much more effective in talking to the business people. And it really becomes our business. It's not going to be IT people and the business people, right?
Yeah.
It has to be us.
That's right. Well, Kasu, I think we're running a little bit short on time. So before we go, first off, it's been awesome having you on here. Hopefully we'll be able to have you on again real soon. Do you have any other closing thoughts? Any other points that you'd like to make before we call it a show?
So I made 3 things to take away, right? Okay. So we didn't really get into this, but always model data for purpose, right? Not so if you're building a dimensional model, corporate information factory, semantic model, data lake, understand the needs of why the business would need that model, right?
Right.
You probably need all of them, which is okay. You don't have to have a single enterprise data model. And use data judiciously. Just because you have petabytes of data doesn't mean you have to use all of it. Again, let the business purpose drive your use of data, right? And know your lineage. And because all the other things flow from your data quality program, your data governance program, right? Your data integration program, your data enrichment program, they all flow from understanding lineage of data, right? And so those are the things that other than what we just talked about, know your business, And when you're dealing with data, keep those three things in mind. I think you'll do very well as a data management professional.
Fantastic. Kasu, thank you for being on the show. I really appreciate it. And I all of the great wisdom, I definitely can see the value in the wisdom chain and in the perspective that you bring.
Thank you, Anthony. And thank you for having me. It's a pleasure always talking to you, whether on camera or not. And thanks for everybody that's going to be listening in.
Absolutely. So to the audience out there, thank you for taking the time to be with us today. Please remember to follow, subscribe, like, rate, and leave a review of our show on YouTube and all the major podcast platforms. You can find information about supporting the show directly and how to get a signed copy of my data leadership book at patreon.com/data leadership lessons. Visit algmin.com to learn more about Algmin data leadership and the many ways we can help you become a data leader. Stay safe during these unusual times and go make an impact.